So the following is the sequence for diagnosing the innominates. First, you're going to lateralize, and by doing that, you're going to utilize the standing flexion test first. So you're going to find your iliac crests, and then you're going to follow those back until you get to the PSISs, and you're going to hook your thumbs underneath them. Then you're going to ask your patient to slowly bend forward at the waist, and you're going to see which one follows first. And that first one that went up, if you can see it, go ahead and go again, was on that right side. Perfect. Come on back. Okay, now you're going to ask your patient to lie supine on the table, standing with your dominant eye over the patient. And the next aspect is the motion testing. You're going to confirm by the compression test. Now, the compression test for the iliac crests, for the innominates, is going to be in a posterior and inferior direction. So you're going to compress in and slightly down towards the feet. That's going to access the iliosacral aspect as opposed to just the sacrum. So put your hands on the ASISs, inferior and posterior, and then you motion test one side and the other side. What you're feeling for here is essentially normal feeling should be as you compress one side, it should have a little bit of give as the innominate slides past the sacrum until it starts to catch, and then it'll push up on the other side. Whereas the stuck side on the right here, when you initially compress it, it's got that bony end feel, so it hooks and it just pushes the sacrum. And so you'll feel it push up on the opposite side. So we just got the confirmation there. And most physicians feel that this is more specific. However, it does take more palpation skills. So if you're not sure, you can still confirm with this. But to start off, doing that standing flexion test is also very good. After that, you're going to go on to the landmarks, the first ones being the ASISs. The important aspect of that is to go to the inferior portion of the ASISs. That way you know you're in the same spot as opposed to trying to be on top of them and being unsure as to if you're at the same level. So if you go directly underneath the ASISs and push your thumbs up, on her, the right one, which is over here, seems to be slightly inferior. Then you're going to check the pubic symphysis, so you can either do that two ways. You can ask your patient to go ahead and touch their pubic bone and point to it, or you can use the base of your palm and move from the top down till you feel it there, and then put your thumbs on it. And that one oftentimes will be in conjunction with the iliac or the ASIS, so that right side was again inferior. So now you're going to have your patient go prone, and you're going to check the posterior landmark, which would be the PSIS. So again, iliac crest, you can follow that down to the PSISs, again hooking underneath them. And this one, not a big dysfunction, but slightly superior on that right side, which is now over here because she's flipped over. So her diagnosis for her innominate, the standing flexion test was positive on the right. The ASIS pubic symphysis on the right were inferior, and the PSIS was superior. So with shadow hands, that's going to make the a right anterior innominate.